Hi everyone, hope all are doing great. Today let's discuss about a medical condition named Polycystic Ovarian Syndrome, PCOS. Okay, Polycystic Ovarian Syndrome is very frequently diagnosed with reproductive age women. It's almost diagnosed in 1 among 10 women with reproductive age. So don't get panic if your doctor said that you have PCOS. The most important thing to remember is the condition PCOS is not your mistake. Okay, there are lots of treatment options, so you will be fine. It's okay. With lots of medications and minor lifestyle modifications like diet changes or regular exercises make you fit. Okay, so you may have lots of questions like why, what is PCOS, why PCOS, to whom it happens, and some random questions. So let's discuss about PCOS today. Okay, before knowing about PCS, we need to know the normal physiology, normal functioning of our body to get the concept of PCS. What is PCS? Why it happens? Okay. Now, I- normal basic structure. This is the female reproductive system. This is the vagina. This is the cervix, and this lining is called as myometrium, and this is called as endometrium. These are the ovaries, these are the fallopian tubes, and this is the uterus. Okay, these are basic names of the parts. So to better understand PCOS, let's discuss about the normal functioning of the body. Let's discuss about the normal menstrual cycle, a regular menstrual, normal menstrual cycle. When the menstruation cycle has to begin, at that time, the brain will send signals to ovaries. Okay, the brain will send signals to ovaries via luteinizing hormone and follicle stimulating hormone. Okay, what these hormones do? This both hormones will encourage the ovary to release egg. So egg is released into the fallopian tube. Along with this process, ovary will also release a hormone named progesterone, which is important for lining of the uterus. This is the lining of the uterus. Okay, once the egg released from ovary passes through the fallopian tube and reaches the uterus. If your egg is not fertilized, then this egg is ejected outside, where the lining of the uterus will be shred and the bleeding happens. This process is the normal menstrual cycle. Okay, every woman will have a menstrual cycle ranging from 21 days to 28 days, and the most important thing is track your menstrual periods. It's suggestible and it's a best practice to track your menstrual period. Just track when the period begins and when it stops, um, so that you can assess whether your menstrual cycle is irregular or regular. You can just know the pattern of your menstrual period. If you have any issues with your menstrual period, then you can just note down your menstrual period pattern, or just take a photocopy of your period tracker and carry it when you're visiting a doctor, so it would be easy for the doctor to assess your medical condition. Okay, This is your normal menstrual cycle. Alright, now let's go into the condition named PCOS. What happens in the condition PCOS? Women with PCOS will have high levels of luteinizing hormone. As I already explained, brain will send signals to ovaries to release egg via luteinizing hormone and follicle stimulating hormone. In condition like PCOS, what happens? Luteinizing hormone levels are often higher than the follicle stimulating hormone. So there will not be a LH surge, so the ovaries will not release the egg. Since an egg is not released, obviously there will be no menstrual cycle, or if the egg release pattern is irregular, then you'll have the irregular menstrual cycle. So the in women with PCOS will ovulate occasionally leads to this menstrual cycle issues. Okay. Now you have question like how can I know whether I have a regular menstrual period or irregular menstrual period? This is uh, this is important for us to identify whether we have irregular or regular menstrual period. Okay. Tracking your menstrual period is one of the way that you can assess whether you have irregular or regular menstrual period. Most of the women with PCOS or women with menstrual issues visit doctor complaining about irregular menstrual period. What is irregular menstrual period? Irregular menstrual period, what does that mean? Irregular menstrual period, irregular menstrual cycle means having an unpredictable menstrual cycle, or inconsistent, or irregular, or having heavy menstrual period, or just like missing over your menstrual period. So you may ask why it is important to visit doctor if you have irregular menstrual period. This is not a threatening call for me. This I'm just not threatening you up, but if you have missing or irregular menstrual cycle, the lining of the uterus will get thickens upon day by day. Okay, this thickening of the uterus may provoke neoplastic cells in your body. So it is better to have a preventive action than get into a little tough situation to handle. So I suggest if you have a regular menstrual period, you just visit your gynecologist. So just rule out what happened with your body. Okay. And usually most of the people will ask whether we only if you have ovarian cysts we call it as polycystic ovarian syndrome. No, in few situations women without any ovary cyst can also be diagnosed with PCOS. So that happens. Coming to causes of PCOS, there's certain, we don't know the exact reason why PCOS happens, but there are various reasons like genetic factors, obesity, insulin, hormonal deficiencies, inflammations, autoimmune disorders, and any such conditions may cause PCOS. It's highly unpredictable. Okay, when we have to visit the doctor. Okay, if the major symptom, typical symptom for PCOS is having irregular or absence of menstrual cycle, there would be a random increase in weight, like there is sudden increase in your weight, or you're just feeling so fatigued, you have insomnia, or you are experiencing sudden sleep issues, you started seeing unwanted hair growth in your body, so or some hypopigmentation in your on your face or hands, chest, arms, legs. So and you have a few reasons of infertility, you're not getting pregnant, then it's better option to visit the doctor to know about your health condition. Okay, how the doctor assess the PCOS? Don't get worried. One, when you visit the doctor, the first thing they ask, what are your signs and symptoms? Why you have visited me? What made you to visit me? So just clearly explain what is your issue, what is your body issue to them. Then they start examining you. They may examine your pelvic area, your vagina, and they may suggest a few hormonal tests for you, a blood test for you, um, because in this condition there will be uh, increase or decrease in few hormones, and the doctor may also suggest ultrasound. They may suggest transvaginal ultrasound or an overall abdominal ultrasound. Okay, in transvaginal ultrasound they will insert a probe into your vagina and determine if you have any ovary cyst or expanded ovaries or something. If you feel this is not convenient with you, you can request the doctor for whole abdominal ultrasound, or your doctor will choose to do the whole abdomen, which is completely externally done when your bladder is full. So this process will also diagnose if you have any issues with your ovary. Sometimes the doctor may also ask you to undergo OGTT. What is OGTT? OGTT is oral glucose tolerance test, to diagnose whether if you have diabetes or any issues with insulin or blood glucose levels, etc. etc. In PCOS, you have high chances of getting type 2 diabetes because there is an decrease in insulin um tolerance, like it increases insulin resistance in your body, so the body cells will absorb less glucose, so your blood glucose levels might be increased, so you have high chances of getting type 2 diabetes. When you visit doctor, you may ask like what questions I need to prepare, how should I ask, what should I ask. So you can just list out your questions before visiting the doctor, so that um, it would be quality time spending with the doctor with the correct questions, and you will get whole information from your doctor. Every doctor is so patient, you can ask n number of questions, but make sure you prepare the questions before, so that there will be no much time consuming for you as well as for the doctor. Few questions you may ask when you visit the doctor, like how might you have certain, I have, like how you can tell that you have PCOS. You can ask the question to the doctor, why you have diagnosed with PCOS. Then the doctor may suggest you because of your signs and symptoms or because of your ultrasound. And you can ask whether there are any reasons that why I got PCOS, or you have any danger medical issues with it, what are the treatment options, and make sure to know about the lifestyle modifications. PCOS is majorly treated with medications along with the lifestyle modification. Like lifestyle modification has a major impact on PCOS. What is lifestyle modification? Lifestyle modifications in a diet or exercise, having low carb diet with proper protein diet, and with regular exercise at least of 30 minutes per day for whole week. So you have to stress and ask your doctor about your lifestyle modifications, how to maintain your BMI. It would be suggestible to ask your doctor about this. And you can also ask about the treatment choices for the treating PCOS. If you want more detail about the treatment options for the PCOS, you can just comment below, so that if you people are interested, then I will do a video on treatment options for PCOS. Most women also have issues with fertility when the woman has PCOS, so you can ask the doctor very comfortably about the fertility options, how you can get pregnant. There is no wrong in asking that. Be open with your doctor, tell all your medical conditions, all your issues, so that it would be easy for you as well as a doctor to treat you. Hope everyone are doing great. Women with PCOS, don't get worried or panic. It's okay. It's not your fault. There are a lot of treatment options, and from your end, you have to do little effort onto your lifestyle modifications. So it would be great to treat and manage PCOS. If you have any concerns more, or if you want to know anything more about PCOS, you can just comment below. Thanks for watching. Bye bye. Have a great day.